Can you hear me okay? In the back, can you hear okay? And let me give you a little, can you see okay? Except for the lady that told me she was going in for cataract surgery. Can you see okay? Yeah, all right, I'm looking like you can see okay. Well, I wanted to again welcome everyone to the annual conference. I really appreciate the opportunity to come and speak or talk with you. I don't really actually feel like I'm speaking. I hope we feel like we can have a presentation and a conversation today. I'll be around at least through probably the lunch hour to talk with any of you have any questions. I want to extend my appreciation to Bunchy. She looks like she moved off here for inviting me or asking me to speak. I always appreciate the opportunity to do that. What I'd like to do today is spend a little bit of time about what I think are some of the higher level issues going on in the mental health or behavioral health arena today. Hopefully it's not too high level, that I can give you enough information that's meaningful to either you as a consumer or a professional or an agency. And some of the things I want to talk about, the Affordable Care Act. Many of you have been following that probably closely over the last couple of weeks. Talk to you a little bit about where we're going with the Affordable Care Act and how that impacts our behavioral health system here in Nevada. A little bit about the Medicaid expansion. The two are tied together. Again, get some linkage there. I want to spend a little bit of time making sure people understand as we talk about the Medicaid expansion, a lot of people will be impacted by our managed care organizations. So I want to spend a little bit of time talking about that. A little bit about some of our capital improvement projects, some of our latest budget items, and sort of end with where do we go from here. So let's go ahead and get started. We'll start with what I call the slides of what's going on. This is kind of hard to see. I'll drill down a little bit, but what this shows is where the nation started and where specifically Nevada has been, as we have high number of uninsured individuals. And particularly in the behavioral health arena, it makes it very difficult to access services in the private sector if you are not insured. And so one of the things that the Affordable Care Act intends to do is to lower the uninsured rate in the nation and in the state. And the beginning point here in Nevada is that we have about a 22% uninsured rate. So if there's 100 of us in this room, 22 of us are not going to have an insurance source. And so that creates barriers, access issues, etc. And it also puts, if you will, pressure on the state system to provide more services, more access points for those that don't have private insurance. So we intend, collectively, we intend to change that over the next couple of years. That our plan in Nevada is to drive down the uninsurance rate, and I'll talk a little bit about it. So this is just a high-level chart that's hard to read about what's going on. And I will digress for a minute here. If this is hard to see and you've got some sort of device, you can go onto our website or later. This presentation is on my website at dhhs.nv.gov. Again, D as in dog, hhs.nv.gov. You can click on our presentations and find this there. This next chart, some of us learn by pictures and some of us learn by the math. I'm a math learner, not a picture learner. But if you look at the website, I know this is hard to see today, but this is kind of shows you what's going to happen in our projections, our actuaries and forecasters, what's going to happen in Nevada. There's about 2.8 million of us in Nevada, and as I said, a large number of us are uninsured. That uninsured number is about 600,000 people out of 2.8 million. 600,000 have no insurance. And so again, in those percentages I'm talking about, the goal is to get more people insured, and we intend to drive down that 600,000 uninsured to around 300,000 over the next 18 to 24 months. Well, we believe that's probably the best success we can have. I would love to have more success than that. but there are certain demographics and economics in the economy that there just will never be a 100% insurance rate. If you follow insurance or uninsurance in the nation, the best two states in the nation, I believe, are Massachusetts and Hawaii, that have very high insurance rates or very low uninsurance rates, around 6% or so in those states. And so I don't think Nevada will be able to accomplish that, but that's our goal. So this is some math is what's going to happen. So let me get to the next page. So this is really, I think, drilling down. So what's going to happen, as I said, right now as we sit today, we're about 22% uninsured, and we believe over the next 2 years that we will drive it down to about 12% next year and about 10.5% the following year. And that's probably where we're going to be. So there still will be about 300,000 uninsured Nevadans, and the others of us, hopefully, will all be able to be insured from the various sources. Now, who will be uninsured? Really, it's going to fall into a couple of groups, and I simplify that. It's going to be the sort of, excuse my French, the hell no, we won't go group. In other words, I would rather pay the tax penalty than be insured. And so that's fine. People have a choice in America. This still is America. You have a choice to choose not to go into an insurance plan, and you have a choice to pay a tax penalty. The Supreme Court has looked at the legislation thoroughly and has said to Congress and to the administration, you have the right to implement this program, and people have a right to choose, and you have a right to tax people if they don't want to be insured, and people can make their choices. So that will be one group that will be uninsured, and the other significant group that will be uninsured will be the non-citizens or people who are not lawfully in the United States. So they still are here. And they still will need health care, they still will need mental health care, they still will need behavioral care, but they will not have access to many of the insurance products that are available. So largely that will be the two groups that will be in the uninsured group. Now, where will the uninsured now, those 600,000, where are they going to go? Well, there's two things. One, in December of 2012, Governor Sandoval elected to implement what we call the Medicaid expansion. And this is very important to the behavioral health group, and I'll drill down some more on that. So in Nevada, we've been a pretty stingy state for years and years about our Medicaid eligibility. We have one of the lowest coverage rates, per capita spend rates in the nation. We have not made it easy for people to get on Medicaid. We've been a stingy state, I'll just say that. Well, Governor Sandoval intends to change that by his election, not his political election, his election or selection to expand the Medicaid program. And so the Medicaid program is where a lot of people are going to go. We're going to see significant enrollment in Medicaid. We have about 325,000 people enrolled in Medicaid as I stand here today, and we believe that expansion that will start in January. It's sort of started now, but it will really start in January, and I'll give you some more details on that. We expect that to grow to almost 500,000 Nevadans on the Medicaid program. The other place that people can go is into qualified health plans, big long word. Basically, that's to go to the marketplace, the Nevada Health Link, whatever you want to call it. I'll give you some more information on that. And you can purchase an insurance plan if you meet certain criteria, and you can get a tax credit to help you with that tax plan. And then people still obviously will get their insurance through their employer or through Veterans Administration or Medicare, those kinds of things. So that's the big three places that you can go. You'll get it through your work, Medicare, Veterans. You will be able to purchase insurance with subsidies, or if you're low income, you're going to be eligible for the Medicaid expansion. Here's just some more stuff about the numbers. Kind of where do we expect things to go? Again, on your left, the uninsured. Again, I said around 600,000 uninsured today. We intend to drive that down to about 300,000. The next column over, between Medicaid and Nevada Checkup, you're all familiar, we run a Medicaid program, then we also run a health insurance program for children. And so that 339,000 number there, that it combines both the Medicaid and the checkup children. We expect that to grow to over 500,000 recipients. So you can see, again, a lot of Medicaid enrollment over the next several years. The next line is what we call the QHP. Again, I'm going to use QHP several times today. It stands for a Qualified Health Plan. It basically means you're going to be able to go out and shop and compare and buy a health plan to meet you or your family's needs through the Nevada Silver State Health Insurance Exchange, or what we call Nevada Health Link. So that's not online, or wasn't in 2013. That ability to shop and compare and start purchasing for January 1 coverage just started 2 weeks ago. And we believe that we'll get around 100 to 120 or 30,000 people enrolled in insurance through that process. You've probably read a lot in the paper how the federal government and the states are struggling to get that off the ground. There are concerns. We do have problems. It isn't perfect, but I'll tell you, it is working here in Nevada. We can enroll people. We've had about 110,000 people create accounts, start setting up and doing navigation. 29,000 or so are getting further into the system where they're actually getting to the point of I'm shopping and comparing things. We've actually had about 1,500 people pick plans. And so it sounds like small numbers to start with, but that's the message we've been saying. Go out, shop, compare. Just like buying a car, go from lot to lot to lot, shop, compare. Do you want a Ford? Do you want a Chevy? Do you want a gas hog? Do you want a gas saver? Whatever you want. And so shop and compare, and then before December 15th, you need to make a decision to buy for January 1 coverage. And then if you don't do it by then, you need to make a decision by the middle of February to buy for coverage. And if you don't buy by that time, you could face that tax penalty. But again, as Americans, as Nevadans, you have a choice. You don't want to buy, don't buy. And then just when you get your tax bill in a year from now, you'll say, hey, wait, did I make the right choice or not? And so that's how it's set up to work. And then if you don't enroll by the end of March, then you can't re-enroll for a year later. And so those are key dates for us all to understand, and I'll try to tie it together here. So access to healthcare coverage. Why is it important? Again, I said you need to have some sort of coverage or a safety system or an ability to access services. So again, the intent in the Affordable Care Act, and specifically here in Nevada, is to tie the Medicaid program, the health insurance exchange where you can buy a QHP, but other health insurance programs together. We've spent a lot of time over the last 2 and 3 years designing automated systems that can work behind the scenes, that hopefully when people come in, they can have a single shopping experience, and we'll put them in the right bucket. And I'll show some of that more buckets. If you picture a triangle, you got the state Medicaid and welfare division determining eligibility for low-income people. You've got the exchange out there where people can shop and compare, which is called Nevada Health Link. We have that all tied together with the federal hub, where we go out and we're doing real-time interfacing between all of those systems, trying to figure out how to cover people for health care. So that's the new thing. That's what's important about the Affordable Care Act. Again, believe in it or not, I don't want to spend a lot of time, arguing about whether it's the right thing or the wrong thing to do. I'm really talking today about how we're implementing it here in Nevada. Okay, what's the most exciting thing about this whole issue? This is huge in the mental health world. If you don't take anything away today from my yammering and blabbering, remember this page. Childless adults will be eligible for Medicaid January 1. That's never occurred in Nevada. Childless adults. Thank you. Childless adults under 138% of poverty will be eligible for the first time in Nevada for Nevada Medicaid. And you can think of, as professionals, as service providers, or as consumers, the difficulty to get access sometimes because of pre-existing conditions or because my income didn't let me, or because there simply wasn't a category of eligibility in Medicaid to get that. So starting January 1, childless adults can be eligible. If you're in the eligibility world, you know how difficult it is as a childless adult to get an eligibility. You had to basically be found to be disabled, you had to go through the SSI, Social Security determination process. That can take 18 to 24 months. Meanwhile, you're not getting services, health care, whatever. Now, January 1, childless adult, you come in, your income's under the guideline, you can be almost instantaneously made Medicaid eligible, and we can connect you into services. So that's a huge takeaway. This is a chart. Mary's got some popping graphics there. This is a chart that I don't expect anybody to try to figure out today, but one of the takeaways I want to make sure that as a group you understand, and I've used the term buckets before. I'd like to simplify things. People think that I'll just be in one program, me and my family, if I choose. If I'm over this income limit or below this income limit, I'll either get a QHP, Qualified Health Program package, or we'll all have to be on Medicaid. Not true. We will look at a family's income, and based on different buckets of eligibility, your family could be covered in different coverage groups. And so I always like to say, what if you have dad, mom's pregnant, and there's a couple of kids, and they're at 150% of poverty, which is about $35,000 a year in income. Well, we will be doing an automated check on people's eligibility to figure out how we cover the children, how we cover the pregnant mom, how we cover dad. And they could be in multiple buckets and get their health care through different systems. A child could be on Medicaid, a child could be on Nevada Checkup, the mother could be on Medicaid or in a QHP, and dad could be in Medicaid or a QHP. And so we will do all that checking behind the scenes, and you will be able to make choices, and you will get coverage that way. Again, I'm going to emphasize, over here, the childless adults piece, that yellow or whatever color that is a brand new eligibility coverage group, never ever offered in Nevada. We're one of about 14 states that have never offered Medicaid coverage to childless adults unless you have been proven to be disabled or you're aged or blind. And so that's a big, big deal. If you don't take anything out, I say again, remember that. Childless adults are eligible. We need to help them enroll. We need to get them coverage so that they can have better access to service. And that's a huge thing in behavioral health. Before I leave this page, there's a word I want you to remember too. Magi, and that isn't that knights and queens and wizards and all that stuff. Magi means modified adjusted gross income. It's a tax term. In the past, everybody's eligibility for programs was determined based on a net income test. You had to figure out the gross incomes. People got different deductions. It's hard, it's confusing, back and forth. The new way we're doing business is we look at your magi. That's your modified adjusted gross income according to tax terms. And based on the magi, that's what these charts mean, you can be eligible for Medicaid in different buckets. Kids age 0 to 5 with the magi below 164 are eligible for Medicaid. Kids age 6 to 18 with the magi below 138 are eligible for Medicaid. Kids with a magi below 205% of income are eligible for checkup. You can get the process. So it's your modified adjusted gross income compared to one of these buckets. We put you in it, you purchase a plan, and we cover you with health insurance. The next page is how do you go about doing it? Just need to check my clock here. Bunchy wants me to talk a little longer, so I'm trying to be respectful of where I'm at in the process here. New eligibility engine. I've said you don't need to worry, you need to go on somewhere and apply if you need health coverage. And so we really want to emphasize the no wrong door. There's no wrong door means you come in whatever door you want. There's not one front door to the system. You can go into Nevada Health Link, who've got their website and the phone number up there. If you want to figure out how to get coverage for you or your family, go to Nevada Health Link, shop, pick a plan, do what you need to do, and the system will help you get in the right buckets. Or down on the bottom, for us that have worked in HHS for a long time, you can still come in through Access Nevada. That's a website that we have on the DHHS website. You can apply for services there. You can go into a welfare office. You can go into lots of helpers. And we're planning to outstation some into our mental health offices and some of our other community partners and things like that. So we're helping people identify their eligibility for healthcare coverage. So there's a number of ways to get coverage. Now, before we leave Medicaid, a lot of people are very confused about the traditional way that people become eligible for Medicaid. What if I am disabled? What if I still want to be proven eligible for SSI? Absolutely, we want you to continue to do your Social Security benefits. It's important, not just from health coverage standpoint, but SSI is a monthly income. Social Security is a monthly income. There are benefits to having that. You still will need to and want to go through that disability determination. Again, for physical disability, mental disability, whatever, you still want to do that, but that's not going to hang up your Medicaid eligibility anymore. You're going to be able to get your Medicaid eligibility because you're a childless adult or because you're a family under the income guidelines. Your disability still is important for us to do, but the old, what we call the MABI program, Medical Assistance to the Aged, Blind, and Disabled, will still be there. You still can get your eligibility that way. But again, I'm really trying to emphasize this childless adult stuff. You know, you can come in, get your health care, still get your benefits going, still get your monthly income. It's all one package. It just, that one may still take some time, but we're going to be fast on your health care coverage. And the other thing is all this automation that we're working on should help us speed up, us being both the federal government and state government, speed up some of the Medicaid case processing tools. Now, I was asked to talk a little bit about, and again, I think there's some confusion out there, what are the benefits under the Affordable Care Act? Well, all of these plans that are being sold, there's 4 being sold on the exchange in Nevada with multiple tiers of coverage, and then Medicaid, they all have to have 5 essential health benefits in their plan. And this is the list. I don't need to read them all to you, but ambulatory patient services, emergency, hospitalization, paternity. Number 5 is the big one. All the plans have to have a mental health and substance abuse use disorders coverage package. They all have to have something. So there's been some confusion out there. Oh, well, they can write this out and there won't be mental health programs, there won't be behavioral programs. If you are getting essential health benefits through the exchange or through Nevada Medicaid, required covered services. Number 5 is your takeaway here. Number 6, 7, 8, 9, 10, this is the list of the essential benefit, the essential health benefits that all those programs being sold have to have. And so, and we've tested them, you know, the insurance commissioner, Scott Kipper, John Hager with the Silver State Health Insurance Exchange, me running Nevada Medicaid. We've worked with the feds for months and years now, and we've got it figured out. The essential health package has to be there, and if it's not, we will hold an insurance carrier responsible for providing those essential benefits. So that's an important takeaway. Now, I'm drilling down because I want people to understand this. So you're either going to be in a QHP, you can be on Medicaid if you're poor, or you can be one of those hell no I won't go people, and that's fine. But if you're in Medicaid, if you're a childless adult or a family and Medicaid coverage, I want to make sure you understand this. Right now, we put families and children into managed care plans. In Nevada, you deal with 2 managed care plans if you're Medicaid covered. You deal with Amerigroup and you deal with HPM. There are 2 managed care covered plans. That's moms and kids. About 61% of the people we cover on Medicaid are in a managed care plan. The other 40% are in fee-for-service, where you just go see whatever doctor you want, and we pay the bills. The plan going forward is that we intend to expand the Medicaid coverage, the managed care coverage in Medicaid, to be about 80–85% of our recipients in managed care plans. So you're going to see increasing coverage on either Amerigroup or health plan of Nevada. And I know we have people that are, I don't like them to be care managed, I want to be fee-for-service, all kinds of things. I'm just here to tell you that's the new way of the future. There will be more managed care and there will be more care management. So the childless adults, January 1, the new eligibles, whatever you want to call them, in urban Washington, Clark County, they will be in managed care plans. You will need to pick a plan. That's part of the process. So if you're a childless adult, haven't been covered before in Nevada, and you're going to get Medicaid coverage in January, you're going to be picking a managed care plan. Now there's groups that will be accepted and waivers that will be given and a lot of detail that we can talk about there. But in general, if you're a family with kids or you're one of the new eligibles, you will be in a managed care program. Just a slide here, just for a minute. Again, if I don't need to take the notes today, but you can look on the website.